This is the third meeting of the Global Forum. We are really pleased here today to be presenting some distinguished panelists. The title of our panel is Strengthening Global Cooperation Toward Addressing Lead Exposure, with the question of what's next. Before we begin, just a couple of housekeeping issues. Please make sure your microphones are on mute if you're not speaking. First up, I would like to introduce our panelists. We have Dr. Steffi Richter, Officer at the German Federal Ministry for Environment, Nature Conservation, Nuclear Safety and Civil Protection, in the Unit for International Criminal Safety and Sustainable Chemistry. She's a chemist by background and has worked in the environment industry for 30 years in various areas and has experience working with the Geneva Convention on Air Pollution, the Paris Agreement, climate change, Stockholm Convention, minimum, you name it, she's done it. She's also been representing the German presidency in G7 for chemicals issues. We're also pleased to welcome Angela Vandermeer. She's an International Environment Project Manager at the Office of International Tribal Affairs of the U.S. Environmental Protection Agency. She's been working there since 2000 on establishing and implementing effective international partnerships and projects to address a variety of global environmental issues. She's worked with international organizations, finance institutions, governments, industry organizations, all sorts of types of stakeholders on global efforts to reduce environmental health impacts of all sorts of topics: maritime shipping, transportation, hazardous chemicals, persistent organic pollutants, lead and paint, gasoline, mercury, and keep going. She's coordinating the U.S. engagement in the global movement in lead paint, and also co-sponsored led the U.S. co-sponsorship of the G7 workshop, which we're looking forward to hearing more about just shortly. Next, we have Jürgen Ludwig, who is a senior expert at the European Commission. He's working as a team leader for international chemicals policy in the Safe and Sustainable Chemicals Group of the Director General for Environment at the EC. He is in charge of international work under the Rotterdam Stockholm Convention, as well as SACA, which is the Strategic Approach to International Chemicals Management, and working specifically on their implementation in the European Union. He also has expertise on pesticides as well. Next, we have Rachel Silverman-Bonnefield, a senior fellow at the Center for Global Development. She's leading their policy-oriented research and convenings on global health financing and policy. Her current focus centers around procurement and access models for global health products, incentives, global health innovation and delivery, and especially focusing on global health crises that have neglected, including antimicrobial resistance and lead poisoning of children globally, as well as preparedness and response. She's been working on a number of publications related to health and development topics, universal health coverage, contraceptive financing, and many, many more. Last but not least, we're pleased to have Leslie Onion here with us from the World Health Organization, where she works as unit head for chemical safety and health here in Geneva. She's a toxicologist by training and has over 25 years of experience in management, poison information, occupational environmental health, and has worked in government agencies as well as intergovernmental levels, including OECD, UN Environment Program, in addition to WHO. So welcome, everyone. We're really pleased to have you here, and I look forward very much to the discussions. And might I ask Steffi to please start us off?
Thank you very much, Rachel. I hope you hear me well. Thank you. Thank you very much. And I'm very pleased to have the opportunity to speak today here on the work of Germany under the 2022 G7 presidency. This year when Germany was in the role of at the G7 of the presidency of the G7, I would like to can confirm that we succeeded for the first time in firmly establishing chemicals management as an important tool for achieving Sustainable Development Goal Target 12.4 in the Environment Ministers' Communique. Under the chapter of chemicals management of the community of the Environment Ministers, several items of the issue were touched. There were first the recognition of the global pollution crisis as one of the three UNEP communicated crises beside of climate change and biodiversity. We, the G7 want to contribute to the open-ended working group of the negotiation of the science policy panel. They are striving for an ambitious result of ICCM5 of the strategic approach of international chemicals management. They support the implementation of the global harmonized system. They are ready to contribute to the capacity building for developing countries and countries in transition for implementing of chemicals management, and they address the issue of lead. To explain to you the altitude of which the minister's statements are created, they are not going into the details. They are declaring on specific topics which should be started to implement or where concrete action should be started, but on a very general level. As a concrete action and follow-up of the Environment Ministers' communique on lead, we organized a workshop together with the US EPA and the European Commission. Thank you very much, Angela and Luca, for the joint action to organize this workshop. For the moment, we are extremely happy that the ministers expressed to have understood that there is an urgent need to address the global pollution caused by harmful substances as a whole, which has not been identified as another first major planetary crisis along climate change and biodiversity loss. We are extremely happy on that negotiation success. The workshop on lead was initiated to explore and understand how urgent it is to act on the lead issue. For that reason, the G7 underscored their strong commitment to reduce lead in the environment, to reduce the disproportionate lead exposure in vulnerable communities, and to encourage appropriate domestic regulation or control of lead in all countries. Following from that commitment, the workshop should take stock of G7 activities and develop possible actions for future work and cooperation on sources of lead to reduce lead exposure in developing countries. The workshop was held in Berlin in a hybrid format on the 9th and the 10th of November this year. And the aim was to identify areas for action, to strengthen the work, to minimize lead pollution. And as an important point was to collaborate with multilateral organizations such as UNEP, WHO, UNICEF, and others. In follow-up of the workshop, there will be created a report on what has been presented at the workshop and what the severe situation is. The structure of the work of the G7 is that we have every year a new rotating presidency who can take up issues within their capacities. That means that the G7 mainly provide guidance for what is urgent to work on, but they are setting signals and they are heard. That does mean that G7 are addressing the issue, especially lead in this case, and set it as a priority. But the plan now is to communicate the concrete results of exploration of the workshop referring this issue to the ministers to initiate, to set their priorities, including other issues also for lead. And what we would like to add is to achieve our goal of significantly reducing global lead pollution, we need a larger framework for global sustainable chemicals and waste management overall. And this requires strongly cross-sectoral and international cooperation and capacity building for developing and emerging countries. And we, as German presidency for the ICCM5's International Chemicals Management Conference, are ready to create this framework in the negotiations on sound management of chemicals and waste beyond 2020. The ICCM will be held in the end of September this year, from the 25th to the 29th of September. And we hope that we will be successful to commit it to an ambitious outcome of the 5th of the ICCM5. Beside of the ICCM5, we are planning to hold a side event to explain and create awareness on the urgency to act on the global lead poisoning and lead pollution. And we are optimistic that we also again create awareness of higher level personalities, because we will have a ministerial conference beside of ICCM5 on the 28th and 29th of September 2023. And for the moment, we are inviting ministers and persons on higher level to be with us in the high level segment to developing a high level declaration, which will not specifically mention lead, but will create a basic and hopefully ambitious basis to work against global pollution at all. This is planned for Germany and the further procedure of G7. Thank you very much. And I think others can add on that. Thank you, Rachel.
Thank you very much, Steffi. It's really wonderful to have an understanding of that event and what might come out of it. So I would like now to ask Angela to provide her perspective from the US EPA.
Thank you very much, Rachel. And thank you also to Steffi and the German presidency and all others who helped organize the G7 workshop. And just to add to what Steffi said, I think another outcome of the workshop was the discussion itself, bringing together groups that may not have ever all been in the same room together. And I think that galvanized a lot of cross discussion, hopefully a lot of networking and follow-up. And so we think that the workshop report itself, can be a resource for others moving forward as well, not just for the G7. And the other thing, we heard from a lot of experts about the various issues and had some presentations, one of which was very interesting and hard-hitting about the economic impacts of lead. And it just raised again the idea that really this is something that has a big impact on people. And the estimates were much higher. These were World Bank estimates to be published, much higher than previous estimates. So that was something we learned as well. And then with regards to addressing the actual sources that exist, I think there was clear support for the ongoing work. There's been lots of ongoing work over the years to reduce sources where there are already solutions available, such as for lead acid batteries or for paint. And then for other sources, there was clear, discussion about possible next steps, such as for some of the cookware and spices. And more information is being gathered on that. So we'll have a better sense in the future. And then, so from our perspective, beyond the G7, I think that we are also very pleased the G7 are going to, consider taking this up. And we are also, the US anyway, and we encourage other G7s to reach out to G20 colleagues who are also galvanized, hopefully, to address this issue, and we can have them bring it up on their agenda as well. And we think too that, it's clear that there's a lot still to be learned, a lot that needs to be known and some barriers, but I think there's clear action in some areas. So the balance of action to reduce sources as well as surveillance and research, striking that balance, I think will be important moving forward. And then what I wanted to bring up from EPA's perspective, where our expertise lies, as you heard from my bio, where I've worked on many different partnerships globally, voluntary partnerships to address global environmental policy issues. And one of the things that we've learned from that is that this can be quite effective, and learning from past models is very important and can ensure success of future efforts. So I wanted to mention two particular examples, and these are just examples of many, I'm sure, but the two I'm most familiar with are the work that was conducted on banning lead from gasoline or petrol. And it was spearheaded by the United Nations Environment Program, but it was actually a coalition of the willing of the key stakeholders, especially industry, the reformulators, the auto industry, and then governments and NGOs, and they worked together. And the most important thing was that there was an agreement on a common, simple, achievable goal, but there was not an avoidance of tough issues. There was conversations around that, and there were sometimes tough conversations, but they were able to get through it through a trust and a transparent conversation with each other, and the roles were clear. Of course, there were funding commitments that helped, including from various governments, including our own at the time. And then we built on this model also to address lead in paint, as you know. So it's a very similar model, and we were able to reach some very difficult decisions to maybe agree on a low level for lead in paint. And so what happened was we were able to use this tool to then work with governments, with WHO and UNEP, who lead this partnership, to actually work on the ground with governments. And what we're finding is working on lead paint policies can often dovetail with other lead policies. And so we're often finding ourselves working with the Ministries of Health and the Ministries of Environment, bringing them together, and they're exchanging information, and sometimes they're also then looking at other lead sources. So this can then, lead to other success. And so I think that there's a lot that can be learned from these things. And I think moving forward, EPA will continue to work on lead paint, but we're also looking into other options. We would like to leverage our efforts and our expertise and build on our strong US domestic programs. And we want to contribute to reducing lead in developing countries. So we're looking forward to learning more. And maybe I'll bring this up later, but just quickly now, another thing people can do is there is an existing awareness raising effort spearheaded by WHO. So I'll put a big plug in for the International Lead Poisoning Prevention Week. And I'm sure Leslie will address that as well, but that is definitely something people can do now. Thank you so much.
Thank you very much, Angela. It's really great that we have EPA's guidance, as they have taken and been a leader in lead and many other environmental issues. So I'm sure we're looking forward very much to leveraging that experience and bringing that to the many countries who are looking to also address lead poisoning. Next, we have Jürgen, who will talk to us a little bit about how the European Union is addressing lead exposure. Please, Jürgen, go ahead.
Thanks a lot, Rachel, and good afternoon, good morning, or good evening, dear colleagues. It's my pleasure to participate in this webinar, and I would like to express my thanks first to the Global Alliance on Health and Pollution for organizing this webinar and providing us with this opportunity to discuss this very important topic of lead exposure. And I would also like to repeat my thanks to Steffi and also Angela for having put so much effort into this G7 workshop, which we very much appreciated. Yeah, the EU puts a high importance in general on sound management of chemicals and waste in order to achieve the highest level of protection of human health and the environment. And the European Green Deal sets out a zero pollution ambition, which is already being addressed by the adoption of the chemical strategy for sustainability, which includes also an external dimension and also the EU action plan towards zero pollution for air, water, and soil. This action plan, in fact, announces that the European Commission will explore a global initiative with international partners to end informal recycling of used lead-acid batteries, because this has been recognized as one of the most important areas where lead exposure is of so high importance that it requires immediate action. And when looking at the workshop and the discussion held at the workshop, this has been confirmed by, I think, by the discussions. Therefore, we see this also the work under the G7 as, in fact, a step to respond to that commitment. The EU has for many years, it's more than 40 years already, addressed the issue of lead exposure. We adopted a huge number of legal acts in order to really reduce lead exposure. This starts with lead in fuels, and it continues with lead in paint, jewelry, toys, cosmetic, electric and electronic equipment, ceramic and vitreous food contact materials, and so on and so forth. And we also address the exposure via air. So we have ambient air quality directives that set limit values for the presence of lead. Very recently, we adopted a new restriction on the use of lead in gunshot and wetlands, and this addresses in particular the exposure of the environment, in particular water birds, to lead. In addition, we have some further restrictions in the process. A restriction on lead compounds in PVC articles just got the approval by the EU member states and is now being processed with a view to formal adoption in spring 2023. And in addition, we're also working towards a broad restriction on land in hunting and sports shooting and in fishing weights. So all these efforts are mainly addressing the EU internal lead issue, but we are certainly also looking beyond. So at the international level, we are actively engaging in the work that is currently done under the Basel Convention, where we supported in particular the decision taken by the last conference of the parties to revise the technical guidelines on the environmental sound management of waste lead-acid batteries. This work is now ongoing intersessionally, and the next open-ended working group next year, February, will have a discussion on these guidelines, and we expect that the guidelines might be approved at the next conference of the parties in 2023. These technical guidelines contain provisions that also cover the informal sector and unsafe activities by this sector, because those activities will not be considered as environmentally sound management. So the consequence of this will be that such an activity will be considered not legal under the Basel framework. So this, we expect, will have a quite important impact on improving the situation in many developing countries. The workshop, in our view, provided really an important opportunity to have a broad discussion involving the various perspectives on the issue of lead exposure. The workshop showed in particular that many areas do exist where action is urgently needed in order to address the global lead exposure problem, and it also showed the economic impact of the adverse effects on health due to lead exposure. This clearly shows the need to take further action, and one possibility in our view would be under the Beyond 2020 framework, which has the huge advantage that it's a multi-sectoral and multi-stakeholder framework, and this brings already all the important actors to the same table, so that they can then take concerted and coordinated action. Coming to the end, I would like to underline that we certainly will continue to work with the colleagues, in particular at international level, and in the context of SAICM and beyond, also through the support of the special program and bilateral cooperation, to make a substantive progress in the elimination of exposure to lead at a global level. Thank you.
Thank you very much, Jürgen. It's good to hear of the continued commitment of the EU and of course of other governments to tackling lead exposures globally. And I'm certain also that many of the guidelines that the EU has developed for all of these various sources will prove model legislation, or at least help inform other countries' efforts as they look to address the varying sources of lead exposure. So we hope that we might be able to get some of the legislation in hand so that we can share it with anyone who might be looking for some model legislation. I'd like now to turn over to some of our other panelists here today. So Rachel, the Center for Global Development has a working group on lead. How does this fit in or complement some of the efforts that the other panels have presented here so far?
Thank you, Rachel, and great to be here today. So as you say, we convened a working group on the sort of international burden of lead poisoning, both understanding the challenge and trying to formulate solutions. And we did this in the middle of this past year. And this is a multi-stakeholder group. It's meant to be a mix of people who have long-standing interest and expertise in lead poisoning, people working at the international level, people working domestically from the civil society perspective, from the international organization perspective, government perspective, philanthropic perspective, but also trying to bring in some people and actors who have not necessarily been active in the space historically, and trying to get them interested and to see the burden of this problem, to see the extent to which it's neglected, and bring their institutions more on board and trying to do something about it. And so that's kind of our philosophy here, of trying to expand the tent of people who care about this issue and bring more institutions into the fold. So we're about halfway through the working group process at this point. We'll eventually have a sort of final report and set of recommendations that comes out of that. But one thing that also happened around this G7 workshop is that we were approached by GIZ to, to some extent based on what we were already doing for our working group, prepare a rapid stock taking report to inform the deliberations of the workshop. And we've done this, and we're currently, finishing up our revisions, and we'll actually make this report public probably in January. And this was done on a very rapid timeline. We don't claim this is a comprehensive census of everything that's happening, but it probably is the most comprehensive resource of what's happening, just relative to what we have had in the past, and kind of evidence roundup across all the different sources of lead, what we know and don't know about the data, what the data gaps are, and what's going on at the international level among the G7 countries. This differs a little bit from our working group because our working group is focused on everyone. And this report is really targeted towards G7 countries. And as probably most people on this call know, actually the burden of lead poisoning is not predominantly in G7 countries currently. It's primarily in low and middle income countries. And so the role of the G7 is necessarily a sort of supportive and indirect role, because these are sovereign countries. They have their own governments responsible for solving domestic problems and prioritizing domestically. But we came up still with some constructive roles that we thought the G7 could play in helping construct a more facilitating environment for all of these. So anyway, I won't go into great detail. I'm always happy to talk about it, but just to sort of, for everyone's awareness, we'll have this report out in January, and we're very eager to kind of discuss with anyone interested.
Thank you very much for that, Rachel. I think it's open to invite others to join that working group. So of course, if that's of interest, you'll have to let her know. And we're also looking forward very much to that G7 stock taking report coming out in January 2023. So we look forward to being able to get that out to participants here as well as in other channels. I would now like to ask a question to Leslie. Angela mentioned the importance in her intervention around expanding monitoring and surveillance for lead. And of course, this is one of the key areas that can help move policy forward. There's a lack of data about blood lead levels in country. So what are the challenges for countries to get a handle on this, and what might be some opportunities to be able to overcome those challenges?
Thanks, Rachel. Before we know on this call and the participants of this forum that exposure to lead can cause very much permanent harm, particularly to children, and so therefore prevention of exposure is very critical. And measuring blood lead levels is an important part of prevention. This is particularly so because the clinical diagnosis of lead poisoning can be very difficult. Sometimes there's no clear history of exposure. Many times children are asymptomatic, and so blood lead level is the only way to really categorically confirm the need to remove from exposure and to put in place other investigations, interventions, including clinical interventions and chelation therapy. So blood lead level is very much a very much important part of the preventive approach to lead poisoning. But we see that blood lead level measuring itself is part of a secondary or tertiary prevention strategy. Let's not forget that the primary prevention would be on the legislative and regulatory control of lead exposure and identification of the hotspots and the understanding of the sources of exposure. So whilst blood lead level has many uses, we don't want to sort of be promoting the measuring of blood lead levels in the absence of other actions. And particularly, we don't want to take anything away from the important legislative and regulatory controls, as well as when we know the sources of exposure, we know where to, we know the sorts of places that to look. So for example, if people are living around a lead smelter, for example, or we know that there's traditional uses of lead glazed pottery, we know the likely sources of exposure, we should take action at that point. However, as I said, that blood lead level does have many uses. There was a lot of discussion at the workshop, and there is a lot of interest overall about the role of screening and surveillance to identify particularly high risk individuals and children that may be exposed. There is other uses of the blood lead level in terms of research, and I'm looking at risk assessment exposure, obviously occupational monitoring. The use of blood lead levels for determination of the effectiveness of mitigation is also important. And as Angela mentioned, in terms of the removal of lead from gasoline, the looking at trends of exposure over time is very important to show that those actions are effective. But I think we do have some challenges, not only because in the health screening and surveillance, you need to, well, first of all, we need to have access to the means to take the blood lead measurements and the sort of laboratories availability and so on. You also need very reliable protocols and to take the samples, and whether you're doing these population studies, you need to have comparable protocols to compare the results over time or to compare with countries. So there's a lot of basic fundamental technical guidelines that are needed. there are not many countries really that have surveillance programs for lead in place. We have some of the countries in Europe and in the US, and similarly, some countries have some screening programs where they would screen for those children which either at certain age groups or in certain areas of exposure. So that there are some successful programs, but it's not something that every country has, and it's not something that at the moment that we have, WHO or other authorities are in a position to ask all countries to have screening programs, because we need to have the other parts of the system in place to be able to. First of all, you need to know what is the purpose. Why are you measuring the blood lead levels? Is it to identify those children that might need further treatment or intervention? Is it to measure trends over time? You need to have that very clear before you develop the programs. I think that often that is not very clear, and what we see is people thinking that measuring blood lead levels is some sort of solution in itself, and that's something that we want to really much guard against. But at the same time, we need to look for improving the capacities of countries to do population-wide surveys. We need to perhaps combine the measuring of lead with other contaminants, because these are very expensive programs to be put in place. I think the other thing we need is a very much engagement from the health sector in such programs, because the taking of blood lead is itself a very much an invasive procedure, and there are clear ethical needs that need to be issues that need to be addressed when taking human samples. Again, we need to know what the results are going to be used for. WHO has done a lot in recent years in terms of providing guidance at the individual level for the treatment of individuals that need clinical interventions based on measurement of blood lead levels. And now we are indeed working on similar guidelines for more population-based studies, learning from those successful programs in Europe and in the US, where they have broad population-based studies. So this is a part of the blood lead level measuring programs are part of will be hopefully part of the future. But we shouldn't forget that they're not the answer to everything, and they do need to. We mustn't forget that there's that primary prevention action that can still be taken. Thank you.
Thanks very much, Leslie. I have so much to comment on what you've said, but just to take just a couple of those points. You've really underscored the role of regulation and enforcement, and then blood lead level taking and monitoring and surveillance as these key components of a preventative approach. And so what seems very clear to me is that there's definitely this chicken and the egg problem, where countries need to have some understanding of what their blood level baselines are so that they can identify the sources and do home assessments or environmental assessments. And at the opposite side, kind of vice versa, you really need to have a strong regulatory framework and enforcement in place. But it's kind of like one informs the other. And so the question is really, how do we get the wheel moving in some of these countries that really have been shown to have high average blood lead levels, and those who are really interested and have the political will to really move forward. So I'm very glad to hear from the interventions of the three first panelists that there's a lot of thinking going on in this area about how best to do this and what the roles of the G7 might be to support countries to advance this issue. In addition to the policy options and opportunities that have been so far put on the table, what other options, excuse me, what other policy options or opportunities might exist for lead? May I ask Steffi, Angela, or Jürgen to talk about that? The question is, what other types of policy options than what you've presented here might exist? Please, Steffi.
Perhaps I can start. For me, it was extremely impressive how various sources the lead poisoning and lead pollution are touching. There are industrial sources, there are the use of products, there are areas where regulation might be very useful and is more or less easily to implement, and there are other issues which are very more on the informative side. I guess we have in the EU a framework, a regulatory framework which is adequate to reduce, minimize, prevent lead pollution from industrial sources. I also think we have not the problem with the reuse of the lead containing batteries, but what I've learned and what was very new for me is that there are several products and articles which are contaminated with lead and which also might be intentionally contaminated with lead. And I was also impressed by the information from the US, from the measurement program, that these issues are not only issues of the developing countries, but also issues of industrialized countries. There are articles and there are foodstuffs which are contaminated with lead. They are brought from different countries to industrialized countries by refugees or by people who are changing their settlements, but they are also bought by the online platforms, Amazon and Alibaba and how they are called. And these platforms are not really regulated. They are, in most cases, totally free of control. And this is really difficult because these articles are distributed worldwide. They are not controlled. They are a severe source of contamination of people, of children, especially if it is as far as toys or foodstuffs. And I think this is an area we have to deal with beside of all other. And it's an area difficult to regulate. It's an area where we have to educate people, inform people, and create awareness in industrialized countries and also in developing countries. I think that's very important, difficult for me, and something what I've learned. Thank you very much.
Thank you, Steffi. Angela, would you or Jürgen like to add?
Yes, if I may. Well, I think it has already been highlighted in the various interventions that lead exposure is really an issue that requires a lot of attention because of the diversity of the different sources of lead exposure. And I will not repeat all of them, but I was also surprised learning in the workshop that there are so many sources of potential lead exposure, and all of those need to be addressed, certainly maybe to a different degree depending on the situation in an individual country. But when looking at this from a global perspective, then that there are many sources of exposure that require high attention. Considering this, and I still think that in addition, certainly to national action, which is always the most important place to take action, because whatever is done at global level, it has to be then also implemented at national level, and it will only be effective if the appropriate national action is taken. But the global action can help, can trigger national action, and can also ensure that some international activities are taken that would be for the benefit of all countries. So there is a lot of merit in really considering what global action might be appropriate. And I would like to repeat myself that when I look at the current landscape of the multilateral environmental agreements that address chemicals and waste matters, then certainly the action that is already taken under the Basel Convention is a very valuable action and maybe helpful to a certain degree, but it will not address the issue to the full extent. So further action is needed, and yeah, the future beyond 2020 framework is, in my view, the right place to take action that goes beyond the already existing emerging policy issue on lead and paint, and also to improve the awareness raising, the international cooperation, but also then the possibility to raise funds in order to help those countries that require additional funding in order to address this globally. I do not see at the current moment the potential to get a new instrument that would address lead, similar maybe to the Minamata Convention on Mercury. This is, I think, beyond the current possibilities. So therefore, again, CICEM or the Beyond 2020 framework seems to be the appropriate place by broadening the scope of the activities that are undertaken when looking at the lead and paint emerging policy issue to address the most important other exposure routes as well. Thank you.
Thank you, Jürgen. Angela, would you like to add something?
I guess that leaves me, yes. Just to follow on what Jürgen was saying about, oops, can you hear me?
Yes, we can.
I'm unmuted. Okay, good. I just wanted to make sure. I think to follow on to what Jürgen was saying, CICEM really is a good vehicle for governments and stakeholders. The alliance, the Global Alliance to Eliminate Lead Paint was started under that and has been a success. So I want to echo what Jürgen said. And I also wanted to follow on to what was said before about, I think what Leslie was saying about blood leads. Those are, measurements we take in the US and other countries take too. But in my experience mainly for paint, not so much with fuels, was that blood lead data would have been nice, but isn't always a direct link right away with paints, since that's like a future exposure as paints decay. So blood leads wouldn't necessarily tell you that, and we've seen that in the US too. It's still a big problem from 40 years back and more. So what we've done is sort of like, if you will, a surrogate looking at the lead in the product, so the lead in the paint. And that can raise awareness. So that can galvanize action, especially if a high level is found. So I'm thinking in the interim, maybe continuing to gather information about the lead in spices and paint and other products that, as others have mentioned, might be an interim step while countries build their capacity for the health interventions. And the other thing that struck me, and I learned during and after the workshop, was the awareness of lead that is in foods. There's actually a Codex Alimentarius under the FAO. Many foods have limits for lead in them. And in the US, we have a program to ensure that baby foods have low levels of lead. So that's something that has to be continued to be looked at. And I wanted to mention something that we started discussing in the Center for Global Development Working Group, and also here in the US, is the role of education and reaching out to the educators and the education sector, where you see the impact of the childhood lead exposure on IQ and even behavior. And so that's something also that might be worth exploring in the US, where we're looking at, continued lead sources in schools, both in tap water from lead service lines to playground mats that can have lead in them, et cetera. So that's just another food for thought for everyone. And then finally, you know, a lot of this has to be dealt with at the national level, but in some cases there can be some local level action. And so one of the things that could be explored too is the extent of how to work with communities to raise their awareness and maybe galvanize action at the community level. So that's something we're thinking about as well, because we do that in the US. Thank you.
Thanks so much, Angela, Jürgen, and Steffi, for your additional comments. There's a couple of things I wanted to pick up on here, which are clearly there's a myriad of sources of exposure. And that therefore means there's also a myriad of solutions, legal framework questions, industries to engage, supply chains to think about, and some of the points raised around the codex, for example, and the international trade of ceramics, for instance, or all of these areas have important kind of stories for us to unravel in terms of looking at, well, what were those solutions look like and need, and clearly many places for us to intervene, whether it's at the international level through the strategic approach to international chemicals management, all the way down to the community level, to enable communities to raise awareness locally about lead pollution and its impacts, and of course also the important role of education, nutrition. I mean, this lead poisoning seems to touch very, very many aspects of our lives, which then leads me to kind of this next question, which Angela, you really talked about what local communities can do, or the actors on the ground who are facing these issues. And so I would open it up to Rachel and Leslie in particular, but then also the other panelists, as to what are some concrete actions that participants of the Global Lead Forum or anyone else can do to support further policy action, data gathering, or reduction of lead exposures, especially in LMICs. Rachel or Leslie?
Sure, I can start and then hand over to Leslie. So, I mean, I think there's quite a lot that can be done. A bit of it depends on resources available, but some things are possible even with very low resources. There's a huge role for public awareness and, public education about this as a risk. I think one thing that becomes pretty obvious is that there's just quite low general awareness of this issue. The fact that it is an issue, what the effects are, what the sources are in many of the affected communities. And when people are made aware that they are being affected in this way and that their children could be at risk, they are very motivated to take action. So that broader awareness raising, using local media to draw attention to these issues, this is something anyone can do, even with very limited resources. Talk to members of their community, talk to community leaders, get this on the agenda. I think with more resources, you can start targeting policy a bit more. Probably the single most useful thing you can do is to gather data on the local burden of lead poisoning, which in most settings does not exist. And this seems to be a way, especially if it's locally collected data being brought to the government by local actors, this seems to be quite persuasive in motivating governments to pay attention and maybe start taking policy measures. I think it's hard to know exactly what policy measures to ask for without doing the sort of source apportionment work. There are some things that are always a good idea, like banning lead paint or lead ammunition, some of these basic regulatory steps, but knowing where to prioritize, knowing where to spend scarce political will is always a question. So there needs to be some strategy here. But I think the first thing everyone can do is just talk to members of their community about this as an issue, make them aware, make them understand that maybe it's not just the pipes, it's not just the paint, it's other hazards that they might not think of, and inform them about how they can protect themselves and their children from these hazards.
Yeah, thanks. So I'd just like to follow on from that. I think that the need for continued advocacy is very strong, even when there is some political support. And we found that in the case of the elimination of lead paint, these are issues that are not solved overnight, even when there is a political decision taken to take action. Many countries it's a multi-year, 5-6 years activity, and we need the continued advocacy all along the way. We have quite some experience with partners working in the Lead Paint Alliance on this in the context of the International Lead Paint Week. We have published some guidance on awareness raise, how to organize awareness raising campaigns and so on. And there's quite an appetite for people to know how to tailor their advocacy to these issues, and organizations such as IPEN obviously been doing a fantastic job with local groups. It's interesting that I was just talking to a colleague the other day who decided, like, even it's so just as an illustration of that, in Australia, for example, where they have very strong campaigns and public awareness about the dangers of lead paint for decades, that if you're pregnant and you go into a hardware shop and ask for lead testing kit, or something like this, it often is not made available to you, or the people in the hardware shops don't even know that they should be offering it to you if you are pregnant and obviously involved in home renovation. So there is a lot of we shouldn't ease off or assume that just because the message has been transmitted and action has been taken, that it continues as long as it's needed. There's some areas which I'd like to see that in terms of the Lead Forum members. I think that arranging these workshops that have been done as the Global Lead Forum have been very useful, and this one in particular, it's refreshing to sort of take stock of recent discussions. I think with the G7 workshop discussion, for example, was a very good opportunity for those at the workshop to share experiences, and then for those at the workshop to share it and with Lead Forum members. But there are many subjects that could probably be usefully explored in the coming years, particularly learning from experience of these countries with the national surveillance schemes and so on, and the use of isotopic analysis to look at source apportionment and other things. I think that the researchers, many of them are Lead Forum members, may have experience in that area. So there are a few points there that I'd like to sort of encourage the Lead Forum members themselves to continue sharing their research and experience. It's proven to be very useful for them. Thank you.
Thanks very much, Leslie. That those suggestions are really useful, and an excellent point about, just because legislation has been passed, of course, it takes a long time for action to happen, and that continued advocacy effort is really, really critical. And so I think that a number of things have come out from the panelists here in terms of things that we might be able to share with Global Lead Forum participants, including potentially model legislation, lots of guidelines from WHO, and some interesting ideas around advocacy, especially low-cost ways to take this issue forward. I'd now like to ask the other panelists to add if they've got anything on that topic as well, of what are other concrete actions the Global Lead Forum itself could do, or its members.
Maybe if I could jump in.
Please.
Yeah, and I think what was said, I agree with everything there. I just wanted to add the idea of, in the messaging, what we found for the lead paint work, that it's really helpful. You have to sort of understand a country level and what the messaging is needed there. What's going to galvanize action? What do the policymakers need to hear? What's the local situation? But in most cases, we've also heard it's very important to also then be able to tie into a bigger picture. So often, being able to cite, well, here are what our neighboring countries are doing on this, or here's the economic impact here and in our region, or, you know, there is guidance we can get from the partnership. So it helps the local NGOs raise this. So I think to the extent this is happening or could happen on lead acid batteries, or is happening or could happen on spices, I think it's really helpful to have that. And a lot of that information, as Leslie said, is available through WHO. There's really great information through the Week of Action campaign on lead poisoning writ large and actions people can take. And it's deliberately developed to be simple to use, especially on social media, so that you can, you know, cut and paste, create your own little, you know, tweets, etc. So it's not a very heavy lift, as you said, for people who might not have the resources, but it can actually go a long way to moving forward policies at the country level.
Excellent, thank you. Steffi or Jürgen, anything to add?
Yes, if I may, sorry, Steffi, please go ahead.
No, you can also,
No,
but
no,
okay.
please.
What we here can see from the national level is in the global level as well. I think what is the lack for the moment is that we do not exchange enough information, that we do not work and collaborate enough together in on what we ask for on the national level, to work together and with different, beyond different ministries and agencies and local communities, to exchange the information, to get the information how to act, and that you at all have to act, that we need on the global level, that what we have to, what we like to establish more than in the previous global policy instruments, is to establish the cross-sectoral and cross-organizational collaboration. And that is the value of CICOM, that they bring together the institutions and the sectors to exchange the information and to notice that there are problems and there it's needed to work. And for me, the surprise was that how big the problem of lead is. That is, the World Bank expressed the economic impact of that issue, and they expressed that it is the second big beyond after the particulate matter, and that it means that you diminish the intellectual ability of the people and of the whole countries, and it is really concerning. And to learn that, to bring it to together beyond institutions and sectors and organizations is very important, and that is what we are creating and trying to achieve with CICOM. And that I think after ICCM5 we will ready to create more concrete work in the issues of concern, and to broaden the issue of lead beyond the lead of paint issue. And yes, we are working on that, and I think it's very important to establish all the work also on the global level and to create a powerful framework with CICOM, with a successor of CICOM. Thank you.
Thank you. Go ahead, Jürgen.
Yes, thanks a lot. Well, since many important aspects have already been mentioned by my colleagues, I would like to maybe to focus on two. One has also been raised by Rachel, and I think this is really something that has the beauty of being readily available to a certain extent, not requiring a lot of time, in particular since the regulatory action, which is certainly the most effective one, takes in most cases a lot of time and and does not really respond to the urgency of the issue. But Rachel mentioned the public awareness that can really be used at the local level, and even in small communities, and then it can grow. And this public awareness, this can in fact then also have an impact on the consumer choices. And I think this is where it starts. So as soon as the consumer knows where the risk lies, then the consumer can also make the difference, and then ensure that the children, for example, as far as this is possible, then at the private level, that the children are not known, or that the exposure of children is at least minimized as far as possible. And in addition, one element that has not yet been mentioned is also the very important role of industry. And in my view, industry can act even without being obliged to act through regulatory measures by checking their products and ensuring that if they contain lead, that is not at all necessary in that product, that then this use of lead is immediately stopped, and that the lead is replaced by other chemicals, or may even not require replacement. It depends on the specific product. But I think this is something that each company can do in order to help governments and help the people that would then later be exposed to the lead to get rid of this route of exposure, and therefore protect their health. Thank you.
Thank you, Jürgen, for that. I think you brought a lot of points building on the others. It certainly seems like there's a role for everyone, every industry, every sector in tackling lead pollution and exposures. And some, of course, have potentially more roles than others, but certainly there's a role for everyone. I would like to just ask any of the panelists if they have any final comments before we turn over to Q&A. Okay, very good. So we have quite an active Q&A session happening. I would like to read out a couple of those. I see you also have some hands raised, so invite you to raise your hands. We'll keep track of those and invite you to make an intervention. So we have here comments. Thank you to the EU and the WHO who have supported the government of Nepal and an NGO like us, CFED, to bring mandatory lead paint law within 90 ppm standard. Developing countries have various lead exposures, but almost a complete absence of testing for BLLs, blood lead levels. There is an absolute need to develop blood lead level testing infrastructure. Is there any program on developing country capacity to develop blood lead level testing? Perhaps Leslie, you'd like to address that question?
Yeah. So there isn't, I wouldn't say that I'm aware of any program in terms of led by WHO or an international organization, for example, but there are different aspects. So as I mentioned, sometimes there's the capacity for testing many metals can be done by using the same equipment. So there can be, efforts taken to look at needs in the context of, say, the Minamata Convention and others that will parties need to measure these heavy metals. We're doing some work at WHO together with UNICEF at the country level in some countries to look at, for example, in the case of WHO, implementation of our guidelines for the clinical management of people exposed to lead, and that does include the need to measure blood lead levels. I think that there's a general shortage of laboratory capacity, not only for lead, but for many contaminants in countries. So I think I would suggest that we looked at holistically from that point of view. Of course, as I mentioned, the development of other aspects of the program terms of the protocols and the use of the data and so on also need to be developed. There are several different types of technologies used to measure lead, and so there's a choice to be made there. There is a point of care testing kit that which is a rapid result, which can be useful in screening, but there is a shortage of that technology, and a need to perhaps stimulate some other innovate some other testing methods, and that's something that was also discussed at the workshop, recognizing that there's a need for some innovative development in this area in terms of the technologies that could be made available. So we're also looking in WHO about adding blood lead testing onto the essential in vitro diagnostic list that WHO puts together, which could also encourage countries to see the need to have that in vitro test available. So there are efforts at different points to move forward in this issue, but I'm not aware of any programs as such to develop blood lead level capacity testing in countries. Other panelists may be more familiar with me, but I'm not aware of any specific programs other than perhaps some of the in-country work that UNICEF and WHO are embarking on, but that's to address the issue of lead more broadly, not specifically just blood lead level testing programs. Thank you.
Thank you, Leslie. There's certainly a lack of players in this field. Of course, there are organizations such as Pure Earth and Vital Strategies and IPEN who are working on the ground on these, but there's definitely not any concerted global effort that I know of either. On the chat, we have two questions that I'm going to kind of combine into one, which is related to how do we hold industrial sectors or players such as Amazon or Alibaba? I mean, how do you hold these players to account for either not trading or not manufacturing goods that unnecessarily contain heavy metals? Do any of our government colleagues have any suggestions as to how we can hold them to account?
I'm sorry, I was trying to find the questions and answers, so I missed the last part of your question. Maybe
Sure.
I can answer. Is this about holding industry accountable?
Yeah, yes, holding industry or players such as Amazon or Alibaba. The question is in the context of, there are obviously Minamata Convention has banned mercury-based equipment, but you can still find it and buy it on online platforms. And then, of course, there's other sectors that are maybe illegally or intentionally adding lead where it's not necessary, and there needs to be an attempt to help phase them out. So the question is on how can you hold those sectors to account or help move them in the right direction?
Well, if I may start, I think the first step certainly would be to regulate those products or the use of lead in those products, and then and as soon as it's regulated, then you would have the basis to go a step further and to do control and also then enforcement activities, because this is the way how, to my experience at least, governments act. And in the European Union we have a very exhaustive control and enforcement programs ongoing, and that ensure that products that contain certain chemicals, including mercury or lead, that are not allowed to be placed on the market, do not, in fact, get to the market, so that the consumer is not exposed to them. But in the absence of any legal requirements, this is certainly a difficult task, and it clearly lacks then the basis for a government to act. The government can certainly always talk to industries and ask them to take action, but would not have any possibilities to impose any actions on those industries. So therefore, this is why I said also in one of my previous interventions, for me the most important area to act is the national level, by really creating the national framework, the regulatory framework for the use or the restriction of those hazardous chemicals. Thank you.
I guess if I may add, I would echo what Jürgen said. I think what we found in paint as well, and the industry told us this. They said, you know, we need a level playing field. So that's why we were able to work with them to develop a model law for regulating lead paint. Industry was part of that conversation. And it's because that it takes effort to change. Making paint is like, you know, it's a recipe, and you have to, you know, assess the ingredients. And it's not hard to do. It just takes a little bit of effort once you have the incentive to do it. And we found that, you know, just without the regulatory pressure, it's just not going to work. But I do think in terms of incentivizing industry, this is where what I said about measuring lead in the products can be helpful. Even if there's no regulation, it may be at least somewhat helpful in getting some change, especially if the substitution is easy to do, you know. So for paint, you know, we have a NGO like IPEN and others now that take data on paint, and they don't just, you know, punish the industry by publicizing that. They go to the industry, and it's a collaborative effort. It's, you know, this is what we found, and why are you doing this? And I think that is important. I think working in concert with industry rather than opposing industry is probably the best way to incentivize industry, whether you have regulations or not. So I think that's what I would encourage.
Those are all excellent points. Would anyone else like to come in?
I could shortly add to that. We have the experiences from the local agency who are responsible for the control of the regulation, and they reported that for the product side and areas which are regulated, they can only take samples for products which are traded by the online platforms. It's not possible to control it all what is traded by these platforms. And it is right that the industry has a responsibility not to produce and sell products which are polluting the environment and are creating harm to the human health, but also the education, create awareness at the consumer side is important, because they are selling these products. In many cases, they have no idea what they are selling. But for instance, for such issues, for the lead issue, they could be informed on what they should or not should to buy. And I think it's also an important issue in this element of this pattern of this problem pattern. I think the industry has a responsibility, but also the consumer has the potential opportunity to act so that they are not creating demand of harmful products. Thank you.
Thank you to all of you for your comments on this. There's a couple of really interesting key points coming out here. You know, this collaborative spirit idea with industry in particular is really, really critical. And of course, we know that creating conflict can absolutely turn the tides in the opposite direction of what we want. So there's a powerful role for engagement with industry in a collaborative, open manner, and really listening. As Angela said, you know, why are you doing this? Do you know you're doing this? Do you know it's harmful? And Many times they may not, but in other cases they might, and there are reasons that people do things. We also know that consumers have tremendous power when they are informed, but often there is very little information and awareness, and many of the questions in the chat here are really reflecting that, whether it's a lack of awareness of the population, a lack of understanding of what potential contaminated products might be out there, a lack of being able to test to find out what products might be contaminated with lead, all through a capacity to actually conduct monitoring and surveillance, both for emissions and health exposures, as well as one of the big questions that I see coming out of the chat is, how do we enforce? It's great, okay, we can get our regulation in place, but how do we enforce it? Any recommendations or suggestions from anyone on the panel?
I can get started. So, I mean, I don't think there's any silver bullet to this. It's a process that has to be built up over time. There are probably some technological investments that countries could make to help the enforcement. The portable XRF machines are not incredibly expensive. They're quite practical for use in the field at detecting whether there is lead in spices or paint or other kinds of substances. I think probably some investments in that kind of capacity that could be used across sources that can be used by people without a tremendous amount of technical expertise probably makes quite a lot of sense. There's also a role for kind of investigative journalism and activism here. You can't really expect investigative journalism to to do blood lead testing or to test the quality of different substances necessarily, but certainly in talking to people, understanding where lead is being added in the supply chain, doing some of that investigative forensic work, that can be quite helpful. But it also has to be a normative change, right? I mean, it has to be, and this is what everyone was talking about on the previous question, it has to be that the paint manufacturers are bought into the idea that they will be removing lead from their paint, that the producers of ceramic pottery agree that they want to upgrade to non-lead glazes and are part of that process. I think a strictly punitive approach that does not actually engage the suppliers and why and how to make this change and why it matters is unlikely to work. But with a combination of bringing kind of industry along with you, giving warnings, explaining to them why it matters, paired with some of these practical investments in detection technology, I think you can move the needle and progressively build on that over time.
Thanks very much. Leslie or anyone else would like to comment?
No, I fully support the comments that have been made by other panelists that there's lots that we can be doing, particularly with the focus on measuring lead in products. And perhaps as I probably hinted at in my earlier presentations, I mean, I think that's equally, if not more important, because it's done measuring lead in humans. Of course, that has a role and has a place, but we know the sources of lead, and so I think people should assume that lead will be in those, can be in those products and test against it and have that type of capacity in the country, rather than putting all of the focus on the blood lead level testing, because after all, we know that there's no safe level of exposure. So it's not like there can be a safe level of it in the spices. Any lead in spices we don't want. So the fact that there's lead in spices in some countries and the other sources are well documented and recognized, countries should be encouraged to really focus on measuring the lead in those products on their markets to see if there's a problem.
Thank you, Leslie. Any final comments from the panelists before I ask one last question, which will be to everyone here?
I think I'll speak quickly. I know there's lots of questions going on in the chat, and I don't know if you plan on getting to the rest of them. But one person asked about, the phase out of lead chromate, for example, which is used in many different products, including paint, and traded, and how can that be done? And so that's something we're thinking about, whether there's a ban of lead chromates like there is in the EU, unless there's an exception, or whether it's addressed if you're a party to the Rotterdam Convention. Then if you have a law banning lead chromate, you can notify that law to the convention, and then that's put through a panel, and if it meets all the criteria, it could be listed, but that's a long process. It's not automatic. That's not an automatic ban of lead chromates globally. The first step really is to ban it. So there's ways to get to the actual ingredient itself, and I think it's also added to spices and other things. So it might be worth looking at that. And the lead paint world, again, we're thinking about talking to those people who make the pigments who add these lead chromates and say, can you maybe stop doing that, and stop it at the source even before it gets in the paint. So that's another thing I wanted to add. But there are some other questions, Rachel. So I'm happy to follow up with anyone who had a question for me if we don't get to those. So thank you.
Thank you, Angela. Yeah, we're coming up on the end of our hour here today. I have a question, kind of a poll to the audience, if I might do that. And then, of course, the Global Lead Forum is here to really enable us to share lessons learned, experiences, talk with the experts, learn about cutting edge research, learn about activities that other organizations or many organizations are working on, as well as efforts globally in those international conversations that are happening. So before I ask my last question, I would really invite all of the Global Lead Forum participants to engage with us. You can visit our website, of course, but even more, we would really like to invite your questions and comments, whether it's a question to the expert or whether there are certain topics that you would really like to just know a little bit more about, whether it's, best practices for blood lead level testing or best practices for XRF use, or, any of these types of technical questions that we can help facilitate as a forum to improve knowledge exchange and awareness around a variety of different things. So happy to receive those. So my last question to everyone, including all participants here, is a little bit of a poll, which is, in your view, how can the Global Lead Forum best be leveraged to advance work on lead? Please provide your answers in the chat. The question is, in your view, how can the Global Lead Forum best be leveraged to advance work on lead? We look forward to your responses in the chat or in the Q&A. And panelists, please feel free also to contribute your responses. Okay, we'll leave the session open just for a few minutes longer. We are recording this. The recording for this webinar will be available on the website, so we look forward to providing that out. Again, please don't hesitate to reach out with any questions you have for experts or ideas for future presentations that you would really like to hear about. And we invite you to share with us how you think this Global Lead Forum can best advance work on lead. We look forward to your contributions and to seeing you in the new year. We will have quarterly events. We may also have some additional conversations if a lot of topics come up. So stay tuned for more news. A big thank you to all of our panelists today. It was a really engaging and interesting conversation. We look forward to next steps in 2023, to the outcomes of the G7 workshop, to hopefully engaging with G20 countries and many more organizations and interested folks in terms of tackling lead pollution. So thank you again. We look forward to seeing you next time.
Thank you.
Thanks a lot. Bye-bye.
Thank you. Bye-bye.